Hi, I'm Dr. Mark Bieszka. I'm a general surgeon at Muskegon Surgical Associates. Today, I want to talk to you a little bit about gallbladder disease. Gallbladder disease is something very common that many Americans deal with. Some of it has to do with our diet, but also it's just the way our body's designed. The gallbladder is a little organ that sits in your right upper quadrant of your abdominal cavity, and what it does is it's a storage organ for bile. Bile's job is to help you digest food, and so common ailments that people will have when they have gallbladder disease, when they eat food, they'll have a bad pain in their right upper quadrant, or they may feel nauseated, like you need to throw up. Some people will feel really bloated. Some people just have a generalized malaise that they just can't explain whenever they eat. Typically, that's gallbladder disease. The way we'll work up the gallbladder to see if it is truly bad is you'll get an ultrasound. Ultrasound is a fancy little device that we use to look inside your abdominal cavity, and it allows us to see if there's stones or sludge or sand within the gallbladder. If there is, and you're having these type of symptoms, then it's typically a bad gallbladder that needs to be removed. Sometimes there are no stones within the gallbladder, but it's still not functioning well, and so we'll get another test called a HIDA scan. The HIDA scan is great for looking at the function of the gallbladder. If the HIDA scan shows that the gallbladder is not functioning correctly, then again, we can remove it to get you to feel better. So let's talk a little bit about the surgery. Surgery is typically a day surgery. You come in and go home the same day. The nice thing about gallbladder surgery is I'm typically able to do it with just a few little poke hole incisions on your abdominal wall. Some of the symptoms you may have after surgery, you'll be a little sore, specifically at your incision sites, which are very small, about the size of a pinky. You may feel a little tired and fatigued. Some of that is due to the anesthesia that you got to put you to sleep. I usually tell people that they want to stay away from the fatty, greasy foods for, a week or two after surgery. And that's because the substance that your gallbladder stored, bile, helps you to digest those greasy, fatty foods. Now, this typically is not a permanent situation. You just have to give your body time to recalibrate after having the gallbladder removed. And most people, almost all people, can go back to tolerating a completely normal diet after having their gallbladder out. Gallbladder disease is very common, and we as general surgeons can help you with that. We can help you enjoy food again, which is a common thing that people love eating and they can't eat anymore. Every person and every gallbladder and every constellation of symptoms is a little bit different. And so if you're unsure or questioning or just have questions in general, please give us a call and I'm happy to see you.